Good morning, and thank you for joining me on my discussion of antidepressant use during pregnancy. This integrative review started with the question, in women who suffer from depression during pregnancy, how does antidepressant use compared to no antidepressant use affect the physical well-being of the fetus during and post-delivery? There's definitely a gender gap when it comes to those who experience depression. 70% of women are more likely to experience depression than men, without the added hormone changes that often accompany pregnancy. Actually, according to the CDC, 235,067 Americans currently suffer from depression. 145,225 of those are women. In 2009, the American Association of Obstetricians and Gynecologists reported that between 14 and 23% of all pregnant women will experience depression. This statistic doesn't take into account those women who are dealing with symptoms of depression pre-pregnancy. A total of 5 studies were taken into account for this review. All studies had to be primary studies published within the past 5 years, had to focus on depression during pregnancy, use of antidepressants during pregnancy, and outcomes in neonates exposed to antidepressants in utero. Of the 5 studies reviewed, one was a prospective observational study, one a review of data obtained from the longitudinal study of Australian children, one a cohort study of 228,876 pregnancies, and 2 were case control studies. Although these 5 studies had different designs, different subject populations, and were performed at different points in time, they came to the same general conclusion. Depression during pregnancy is a real problem faced by many women and should be addressed promptly for the health of the mother and fetus. While antidepressant use can't be declared completely safe during pregnancy, with the main adverse effect being infants born small for gestational age, depression itself puts the mother and fetus at risk as well, and decisions for antidepressant use should be made on a case-by-case basis after weighing both the pros and cons and exploring other possible treatment options. The fact that these studies show that depression can occur at any stage of pregnancy should serve as a reminder to primary care providing nurse practitioners who are likely to see patients at all stages of pregnancy while fulfilling all non-pregnancy related healthcare needs, that depression can lead to adverse outcomes to both mother and baby and should not be taken lightly. A proposed intervention to identify those at risk and to treat early symptoms of depression is to establish an easy-to-use standardized screening tool to be used at each OB/GYN and primary care visit during pregnancy. This tool will allow for early recognition of signs and symptoms of depression and allow the OB/GYN and primary team to work together to educate and treat our pregnant patients. This intervention would easily be piloted at any area primary care or OB/GYN office, as well as at area health departments in cooperation with their HANDS and WIC programs. At this time, I would like to thank you for your consideration in viewing this presentation and hope that you remember that though pregnancy is supposed to be a time of happiness and joy, many experience sadness and despair without knowing why, and are in need of our support and guidance during this time. Thank you.